Hi, everybody. My name is Dr. Ruwan M Jayatunge. Today, I'm doing this presentation on the Buddhist Jataka stories and the DSM-based mental disorders. First of all, I would like to thank the Buddhist and Pali University in Sri Lanka for organizing this presentation, and my profound thanks go to Yodakandi Arivansa Thero. So my presentation is based on my 2014 book, Psychological Aspects of Buddhist Jataka Stories. In this book, I tried to highlight that there are much case studies discussed in the Jataka stories that can be found in the DSM, the Diagnostic and Statistical Manual of Mental Disorders. So it's the handbook used by the healthcare professionals, and it's the authoritative guide to the diagnosis of mental disorders. The Buddhist Jataka storybook deeply touches the DSM-based mental illnesses, and these mental ailments could be identified in many Jataka stories. These Jataka stories are moral and spiritual stories, and it can be considered as case studies of the Buddhist psychotherapy. These stories were compiled in the period from the 3rd century BC to the 5th century AD. It's a collection of 550 stories, and as Professor Rhys Davies, Buddhist scholar, indicated, Jataka stories are some of the oldest fables. Both Jataka stories and Panchatantra, which was written by Vishnu Sharman, these stories written by common people, and it touches moral values. Jataka stories contain a reflective psychological premise and represent a broad structure of mental phenomena, and it represents existential moralistic dimensions of human nature. Jataka stories made a profound influence on art and literature in India, in Southeast Asia, and in Europe. Sir Edwin Arnold, an English poet and the celebrated author of The Light of Asia, gracefully wrote poems about Jataka stories. The Diagnostic and Statistical Manual of Mental Disorders, DSM, is published by the American Psychiatric Association, and it provides broad symptomatology and standard criteria for the classification of mental disorders. It has been considered as the Bible of psychiatry. Buddhist Jataka stories can be considered as case studies, and they discuss many psychological and psychiatric ailments described in the modern day DSM. Buddhist Jataka storybook discusses deep psychological themes and analyzes the human mind. The psychiatrist Dr. D.V.J. Harishchandra, in his famous book Psychiatric Aspects of Buddhist Jataka Stories, that was published in 1996, points out that the Western psychologists and psychiatrists should get acquainted with this ancient DSM, which is called the Jataka Storybook. I had the privilege of meeting Dr. D.V.J. Harishchandra in 2007 at the 3rd International Conference of Southeast Asian Federation of Psychiatric Association. There I mentioned him about my intention of writing the psychological aspects of Jataka stories, and he really encouraged me. The ancient classification of mental disorders, also known as the Buddhist psychiatric nosology, indicated in Dharimukha Jataka, classifies mental ailments into 8 subdivisions. Those are Kama Unmada, sexually deviant behaviors; Krodha Unmada, anger-related mood disorders; Darshana Unmada, mental ailments with visual hallucinations; Moha Unmada, mental retardation; Yaksha Unmada, dissociation and possession disorders; Pitta Unmada, melancholia, or we can call it depression; and Vyasana Unmada, psychotrauma. Jataka stories encourage self-perceived positive mental health. Positive mental health is feeling well, functioning well, and being resilient in the face of life's challenges. Buddhist philosophy talks about the human mind and its pathological and non-pathological portions. Jataka stories describe conditions from mild neurosis to severe psychosis. The Buddhist Jataka stories describe various types of mental disorders and how these ailments affect the individual as well as the society. For centuries, these stories help the people to treat individuals affected by mental illnesses with utmost compassion. There's no evidence of persecution of psychiatric patients in the ancient Buddhist societies. This is a very, very significant factor because in the medieval Europe, psychiatric patients were often treated as the agents of Satan and subjected to torture and execution. Mentally ill women were often burned at the stake as witches. If you could remember Salem witch hunt, and in many European countries, even in North America, there were stories about these type of persecutions. The humane way of treating mental patients started in Europe mainly with the reformations introduced by Dr. Philip Finney. And he initiated moral treatment for the psychiatric patients. Many centuries before Dr. Philip Finney, King Buddhadas of Sri Lanka, 398 AD, treated psychiatric patients with compassion. He was a prominent physician and a surgeon as well as a psychotherapist. According to the history, once an insane individual humiliated King Buddhadasa in the royal court, instead of punishing him, the king treated his mental illness successfully. King Buddhadasa used herbs, empathetic words, and healthy community atmosphere to treat the mentally ill. So he was like Dr. Avicenna in the medieval period. The Buddhist philosophy talks about the human mind and its pathological and non-pathological segments. According to the Buddhist Atthakatha, commentaries on the traditional interpretations of the scriptures, all worldlings are insane. The same words were echoed by the psychologist Eric Fromm. He says that not just individuals, but entire societies may be lacking in sanity. The Vibhanga Attuva, a Buddhist scripture, part of Pali canon of Theravada Buddhism, describes vibrant neurotic features that are perceptible in layman. Neurosis is a term that describes common psychiatric conditions like anxiety, depression, and feelings of sadness, discontentment, or anguish that excessive to the circumstances of a person's life. The Buddhist Jataka stories describe a variety of neurotic manifestations in people. According to Sigmund Freud, the neurosis represents an instance where the ego's effort to deal with its desire through repression, displacement, etc. The Jataka stories give numerous case examples of neurotic behavior in people. Freud introduced psychoanalysis. It's a system of psychological theory and therapy that aims to treat mental conditions by investigating the interaction of conscious and unconscious elements in the mind and bringing repressed fears and conflict into conscious mind by techniques such as dream interpretation and free association. The renowned Sri Lankan literary genius, Martin Wickramasinghe, argues that the psychoanalysis was initiated not by Freud, but by the Jataka storyteller. The Jataka storyteller revealed and analyzed the noble to ignoble characteristics of the human psyche. The Jataka storyteller knew the complexity of the human mind. He described the human behavior in vivid situations. He knew the internal mental conflicts, repressions, and his stereotype of behavior. According to Mark Epstein, psychiatrist and the author, both Buddha and Freud came to appreciate that the source of self-generated misery is an exaggerated sense of self's absolute reality. Freud believed that the inner layers of the human personality consists of irrational and savagery wishes. In contrast, the Buddha believed in the positive aspects of the human personality and its capabilities. Jataka stories reveal hysteria type of reactions. The Webster Dictionary defined hysteria as a psychiatric condition where variously characterized by emotional excitability, excessive anxiety, sensory and motor disturbances, or the unconscious simulation of organic disorders. So Jean-Martin Charcot, Pierre Janet, Sigmund Freud, and Joseph Brewer comprehensively wrote on hysteria. So way before these professionals, Jataka stories discuss about hysteria type of reactions. And so there are numerous characters who have displayed hysteria type of reactions in the Jataka storybook. Sigmund Freud saw traumatic experience in childhood that is uniformly of a sexual nature as general etiology of hysteria. The DSM-4 distinguishes hysteria under somatoform disorders and the dissociative disorders. Jataka stories talk about psychogenic non-epileptic seizures. These attacks resemble epilepsy-related seizures in symptoms and signs, but without abnormal electrical activity in the brain. Psychogenic seizures are triggered by psychological problems. So there are a number of stories. I have selected one story about Illisa Jataka. It talks about one count who was a miser. So he goes into psychogenic fit when he finds his wealth had been distributed among the poor people. He lost his consciousness, then his body shook violently. After a while, he gains consciousness and then demands his property. According to the storyline, after he gained his consciousness, there was no post-ictal period described in Count Illisa. He was not in sedated state, and he woke up and actively cried for his possessions. Jataka stories describe psychogenic itch as well. Psychogenic is related to psychological abnormalities, example, itch in obsessive compulsive disorders, depression, and delusions of parasitosis. So these type of psychogenic itch is described in Gatakumara Jataka. So this is one of the best case examples. The affected person is suffering from psychogenic itch. And also it describes phobias. A phobia is an anxiety disorder defined by an irrational, unrealistic, persistent, and excessive fear of an object or situation. Prince Asanaga is one of the special case studies of phobias. The Prince Asanaga character that is described in Chulla Palohana Jataka story suffers from gynecophobia, or an abnormal, irrational, and persistent fear of women. Jataka stories even describe psychosis. Psychosis is a condition characterized by loss of contact with reality and may involve severe disturbances in perception, cognition, behavior, and feelings. The Jataka stories describe several individuals with a variety of psychotic manifestations. In Labagaru Jataka could be one of the examples that describe a person with insane behavior. For insanity, the Jataka storyteller uses the term umatu. Umatu illustrates abnormal behavior, divergence from reality, erroneous thinking, and decision-making. The Jataka stories illustrate confirmatory examples of psychotic behavior. We can find depression and depressive disorder, which is a mood disorder associated with specific symptoms such as depressed mood, decreased interest or pleasure in most activities, significant weight loss, change in sleep, fatigue, loss of energy, feelings of worthlessness, excessive or inappropriate guilt, diminished ability to think or concentrate, indecisiveness, and thoughts of death or suicide. According to Asaka Jataka, a king goes into depression after his queen's death. The Jataka storyteller vividly describes the king's depressive reaction. that is equivalent to the DSM description. Following the queen's death, the king experiences utter misery. His despair is not ending. He's not interested in ruling the country. In Pandita Jataka, King Vasudeva becomes depressed following the death of his son. And we find pathological grief or prolonged grief. Grief is an intense sorrow caused by loss of loved one, especially by death, something that causes great unhappiness, and it has multi-phase responses. Grief is an overwhelming situation. Sometimes grief reactions are prolonged and the affected person is unable to come to terms with the loss. In Sujata Jataka, that explains the pathological grief reaction experienced by a person following the death of his father. His emotional pain does not heal with time and lasts for a long period. Most of the day, his mind was preoccupied with memories of his dead father, and he used to weep relentlessly. He was emotionally overwhelmed, and prolonged grief impacted his social and private life. According to the story, the sufferer's pathological grief reaction was healed by using an existential mode of interventions by his son. So, Jataka stories discusses existential therapy mode in the later years, what Viktor Frankl described. So disruptive mood dysregulation disorder is a named disorder by DSM-5 that is uncommon and frequently co-occurs with other psychiatric disorders. The children with disruptive mood dysregulation disorder show severe recurrent temper outbursts manifested verbally and behaviorally that are grossly out of proportion or intensity or duration to the situation or provocation. Then the temper outbursts are inconsistent with developmental level. In Virochana Jataka, the Jataka story book gives details of a prince who had positive features of disruptive mood dysregulation disorder. The prince has aggressive, impulsive behavior, temper tantrums, temper outbursts, property destruction. He violates social norms and rules. Then the king sends the young prince to a hermit who has knowledge and wisdom. The hermit uses a form of behavior modification therapy to treat the child. After a series of interventions, the hermit gives an insight to the child. So again, we find the Jataka storybook talks about cognitive behavior therapy, behavior modification, and some form of giving insights and behavior therapies. And the Jataka stories describe intermittent explosive disorder. Intermittent explosive disorder, IED, is a behavioral disorder characterized by explosive outbursts of anger, often to the point of rage, that are disproportionate to the situation at hand. Intermittent explosive disorder falls in the category of impulse control disorders. The condition is characterized by failure to resist aggressive impulses, resulting in serious assaults or property destruction. In Chaitya Daddara Jataka, it reveals a monk with an intermittent explosive disorder, and this monk is easily provoked and goes into violent, impulsive tantrums. He's abusing other monks verbally and physically. His destructive anger causes huge problems for the fellow monks. Later, this monk was reformed by the Buddha. Jataka stories narrates about mental retardation. Mental retardation refers to substantial limitations in functionality. It is characterized by limited intellectual functioning in communication, self-care, home living, social skills, community use, self-direction, health and safety, functional academics, and leisure and work. In Ummaga Jatakaya, we find a count whose name is Gorimanda, who is suffering from mental retardation. So in Jataka story, there's a vivid description about his behavior pattern. So according to the description, the Count Gorimanda has lack of social or emotional reciprocity, poor motor coordination. And when he talks, there is drooling or excessive salivation, and he has abnormal speech. The Jataka storyteller described some autism spectrum disorder as well. So autism spectrum disorder is a neurodevelopmental disorder that is clinically defined by abnormalities in reciprocal social and communicative behaviors and an inflexible adherence to routinized patterns of thought and behavior. So autistic individuals experience difficulties in recognizing and understanding the emotional expressions of others. And naturalistic observations show that they use such expressions infrequently and inappropriately to regulate social exchanges. So autism type of behavior is described uh, in Damia Jatakaya. So this little prince, Damia, he's sort of depicting certain character similar to autism. So this is an extraordinary narrative of prince who displays autism related symptoms to deceive the king and the royal hailers. Little Prince Damia becomes he disgusted with the way his father rules the country, tormenting his subjects. He does not want to be a part of the kingdom. Therefore, little Prince Damia exhibits an autistic behavior pattern disregarding his surrounding. He shows no eye contact, does not respond to social interactions, and does not acknowledge others. By demonstrating these autistic features, the little Prince Damia intends to run away from the kingdom. And also we find conduct disorder as well. Children with conduct disorder repeatedly violate the personal and property rights of others and age-appropriate social standards and rules. Associated features of conduct disorder include inability to appreciate the importance of others' welfare and little guilt or remorse about harming others. Children with conduct disorder often view the world as hostile and threatening place, and they have difficulty maintaining friendships. They often have low self-esteem and low frustration tolerance. Peers and family members become negative and irritated with their misbehavior, which leads to a vicious cycle. Tilamutti Jataka story would be one of the stories that describes conduct disorder in children. So according to this Jataka story, that gives details of a prince who had positive features of a conduct disorder. He violates social rules and shows temper outbursts and aggressive behavior. When his mentor punishes him for his socially unacceptable behavior, for stealing, the prince becomes extremely angry and determined to take revenge on the teacher. We find separation anxiety disorder, which is characterized by an abnormal reactivity to real or imagined separation from attachment figures that significantly interferes with daily activities and developmental tasks. Mahajana Jataka story describes separation anxiety in a child following paternal deprivation. According to Mahajana Jataka story, this child manifests numerous emotional and behavioral problems. The child becomes anxious and it affects his functionality. He becomes withdrawn and relentlessly asks about his father. He's forcing his mother to take him to his father. Finally, his mother makes arrangements to meet the child with his father, and hence his anxiety comes to an end. A learning disability is an umbrella term covering many different intellectual disabilities. It's not a single disorder, but it's a general category of disabilities in following areas, especially receptive language, expressive language, basic reading skills, reading comprehension, written expression, mathematics, calculation, mathematical reasoning. These separate type of learning disabilities frequently co-occur with one another and also with certain social skill deficits and emotional or behavioral disorders such as attention deficit disorder. Chullapantaka is a young monk that was described in Chullasetti Jataka. He is significantly affected by learning disabilities. He could not memorize even a line of a stanza. Although he made laborious efforts, he was ridiculed by his elder brother Mahapantaka for his learning difficulties. Chullapantaka became overwhelmed and decided to give up his monkhood. Finally, the Buddha intervened and helped him to overcome his learning difficulty. We find obsessive compulsive disorder, OCD, in the Jataka story book. So OCD is an anxiety disorder. Obsessions are recurrent and persistent thoughts, impulses, or images that are experienced as intrusive, and it causes anxiety or distress to the patient who tries to ignore them or neutralize them with some other thought or action. Compulsions are repetitive behaviors or mental acts aimed at preventing or reducing distress and anxiety caused by obsessions or by discomforting sensations. Kunala Jataka is a story about an individual who had an obsessive fixation on an inanimate object, a mammoth. Although he became a monk, renouncing everything, when he was deprived of his fixated inanimated object, he could not control the compulsive urge. So Kunala Jataka would be the best storyline for OCD. And also we find body dysmorphic disorder, which is considered a body image disorder. It's a distressing or impairing preoccupation with an imagined or slight defect in appearance. In DSM-4, body dysmorphic disorder is classified as a separate disorder in the somatoform section. Individuals with body dysmorphic disorder have intense preoccupation with an imagined defect in appearance. And if a slight physical anomaly is present, the person's concern is marked by excessive. This preoccupation causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. In Kusa Jataka, the king Kusa is overly anxious about size of his nose. He got married to a beautiful queen named Pabhavati. Fearing his appearance, King Kusa visited his wife only in the dark nights. After the marriage, for a long period, Prabhavati never saw her husband's face. She felt her body only in the darkness. So, Kusa Jataka, the King Kusa's story, is about this body dysmorphic disorder. And also, you can find adjustment disorder in the Jataka storyline. DSM-4 define adjustment disorders as transient states of distress and emotional disturbance which arise in the course of adapting to a significant life change, a stressful life event, serious physical illness, or possibility of serious illness. The symptoms can include depressed mood, anxiety, worry, a feeling of inability to cope, plan ahead of continue in the present situation, and degree of difficulty in a day-to-day living. An adjustment disorder type of reaction is written in Muapotaka Jataka. A hermit in Muapotaka Jataka was closely attached to his pet deer. His pet deer had become his beloved friend. They were inseparable. After some years, the deer dies and the pet loss causes severe adjustment disorder in the hermit. And we can see post-traumatic stress disorder. There's a very, very nice narrative in the Jataka stories. So PTSD is an anxiety disorder that can develop after exposure to a terrifying event or ordeal in which grave physical harm occurred or was threatened. People with PTSD have persistent frightening thoughts and memories of their ordeal and feel emotionally numb. They may experience sleep problems, feel detached or numb, or be easily startled. The Jataka storyteller gives us a remarkable case study about modern day PTSD. So he elegantly portrays the clinical picture of a monk in Dumbalakatta Jataka. The monk's name is Marana Bhiruka Bhikshu, the monk with mortal fear. So he had fear feelings, flashbacks, hyperarousal, avoidance, and startling reactions. The monk who was described in Jataka story fits into the DSM criteria of PTSD. The said monk had fearful feelings, being panicked by the slightest sound. The ancient text describes that the monk was terrified when hearing a sound such as a drop of a leaf from a tree, which is modern day viewed as hyperarousal, fearing the places where he received terrible experience and reluctant to visit them. So there is severe avoidance, troubled by the fearful mental images, the flashbacks, morbid fear, unable to meditate. Uh, Indeed, it's lack of concentration, sweating and heart pounding, activation of sympathetic nervous system, and lack of happiness, depressive feelings, and mental worry. So this is one of uh, the very powerful narratives of PTSD. And we find acute stress disorder. Acute stress disorder, also known as psychological shock, mental shock, or acute stress disorder, is a psychological response to a terrifying, traumatic, or surprising experience. Patachara lost her husband, two of her children, her parents, and her brother on the same day, and she went into an acute stress reaction. In the ancient text, Patachara's acute stress reaction is very well written. How she went into the reaction, how she lost in touch with reality, how she was dissociating. So this is a very, very powerful narrative about acute stress disorder. And we find sleep terror disorder in the ancient text, the Jataka stories. According to the DSM-4 TR, sleep terror disorder is characterized as having recurrent episodes of abrupt awakening from sleep, usually occurring during the first third of the major sleep episodes and beginning with a panicky scream, intense fear, and signs of autonomic arousal. So relative unresponsiveness to efforts to others to comfort the person during these episodes. So sleep terror disorder is a form of pathology. And in Mahasupina Jataka describes this type of reaction. So it gives an ambiguous case study of sleep terror disorder, the Jataka story, also known as the 16 dreams of King Pasena the Kosol. So he had terrible dreams. We can find alcohol abuse and dependence. According to the DSM-4 alcohol abuse and dependence are described as maladaptive patterns of drinking leading to clinically significant impairment or distress. A number of Jataka stories recount the ill effects of alcohol usage. For instance, the Surapana Jataka, Punnapati Jataka, and Bhadrakata Jataka point out health and behavior related problems associated with alcoholism. According to these Jataka stories, the person who abused alcohol lose their rational judgment. Dubbaka Jataka narrates an intoxicated acrobat accidentally kills himself while performing a stunt. The Jataka storyteller gives certain characters very much similar in pathological gambling. So pathological gambling is non-substance based addiction that shares many behavioral and neural features with substance-based addictions. Decision-making deficits are observed in pathological gambling. In addition, the individual with pathological gambling have impairments in self-regulatory behavior. The Jataka storyteller narrates a pathological gambler named Tundila and his abnormal behavior. Tundila's sister Kali was a sex worker, lived in the city of Benares. So Tundila was addicted to gambling and lost his entire wealth. He used to demand money from his sister. Once Kali became annoyed due to her brother's wild behavior and chased Tundila from her house. Tundila was described as a person who was preoccupied with gambling and had loss of control. He was spending an excessive amount of time gambling, often the entire day. He borrowed money from his sister, relatives, and friends to gamble. When failed, he was lying and pleading to get money. He had jeopardized and lost his relationship with his sister due to gambling behavior. The behavioral features of the gambler Tundila is very much similar to the behavioral symptomatology that has been described in the Diagnostic and Statistical Manual of Mental Disorders. Wonderful. Pathological lying is listed in the Diagnostic and Statistical Manual Disorders, although only as a symptom of other disorders such as antisocial, narcissistic, and histrionic personality disorders, not as a standalone diagnosis. However, Buddhist literature described King Chaitya, who was a pathological liar. So we have to ask this question: does Jataka storyteller know about Oedipus complex? As Sigmund Freud described in the Oedipus complex, largely unconscious ideas and feelings which concentrate on the desire to possess the parent of the opposite sex and eliminate the parent of the same sex. Ayodharma Jataka story is about the conflict between a father and a son. The father, the king of the monkeys, destroys the genitals of the male baby monkeys in order to liquidate any impending future threat by male monkey. In addition, the father monkey keeps all the female monkeys for himself, making other male monkeys impotent. One of the male baby monkeys was able to escape physically unharmed and grows up in a hidden area of the jungle. The male baby monkey's mother secretly feeds him. Hence, the male monkey becomes emotionally attached to his mother and hating the father. Once the monkey becomes a fully grown adult, he comes out and challenges his father. In this conflict, the son kills the father and becomes the new king. So we have to ask this question: did the Jataka storyteller write about Oedipus complex? Gender identity disorder is classified as medical disorder by the DSM-5 as gender dysphoria. Gender identity disorder or gender dysphoria is the formal diagnosis used by psychologists and physicians to describe people who experience significant dysphoria, discontent with the sex they were assigned at birth and to the gender roles associated with that sex. Jataka story tales describe gender identity disorder and spontaneous sexual transformation in a count named Soreya. One day, Count Soreya went to the river to take a bath. Then he saw Bhikkhu Katyayana, who was a very attractive and handsome. By seeing this attractive monk, Count Soreya had a sexual fantasy, which later became an obsessive, recurrent erotic thought. Simultaneously, he had immense guilt, feeling knowing the Bhikkhu Katyayana is a perfected person who has attained arahathood or enlightenment. Following self-guilt and severe mental conflicts with elevated anxiety, the Count experienced a spontaneous sex change. So Kelly Shannon Henderson of the University of Connecticut states that spontaneous sexual transformations are relatively rare in ancient literature. The Jataka storyteller wrote about sexual jealousy, also known as Othello syndrome. Sexual jealousy in humans is an emotion of jealousy which may be triggered in a person when a sexual partner displays sexual interest in another person. There are several Jataka stories exemplifying sexual jealousy in males. For instance, in Parvakuta Jataka, a king becomes extremely jealous when he realized one of his queens committed a sexual infidelity with a minister. The king is experiencing extreme emotional pain, feelings of betrayal, outrage, and fear. His violent outbursts and obsessive thoughts are evident. The king believes that his personal sexual and romantic relationship with the queen is now being threatened and he seeks revenge. In Chulla Dharmapala Jataka, King Mahapolana kills his infant son following sexual jealousy. King Mahapratapa was infuriated when he noticed his beautiful queen cared for the infant son without paying attention to him. The king perceives mother-infant interaction with extreme hostility. Following anger and sexual jealousy, he orders to kill the infant prince. Jataka stories talk about incest. We know that even in the Holy Bible, we can find certain passages linked to incest. So incest refers to any sexual activity between close relatives, often with the immediate family, irrespective of the ages of the participants and irrespective of their consent. That's illegally or socially taboo. The Jataka stories described an incestuous attempt in Seggu Jataka, also in Mahapaduma Jataka. In Mahapaduma Jataka, the stepmother tries to seduce a young prince, but he refused her advances. In Kachapa Jataka storyline narrates a homosexual relationship between two ministers of King Pasena the Kosol. However, the Buddhist philosophy does not consider gays as sinners or condemn LGBT people. So this is a very important thing, because persecution of gay people in ancient Europe was a common occurrence, but Buddhist societies had tolerance for the LGBT people. Jataka stories tell us about pathological possession disorders. It was formerly known as dissociative trance disorder in the DSM psychiatric manual and became included within the dissociative identity disorder criteria for the DSM-5. The experience of being possessed by another entity, such as a person, god, demon, animal, or inanimate objects, hold different meaning in different cultures. Yet the phenomenon of possession state has been reported worldwide. So in Ummaga Jataka, we find similar story. The Pandit Kavinda seems to be suffering from dissociative trance disorder, a possession state. As the Pandit describes, it's a transient monthly occurrence on full moon days. When he's under the trance, he loses control of his body as well as the control over his consciousness. His behavior changes rapidly. There's a changing tone of his voice, and he barks like a dog. He loses the awareness of his surroundings, and there is a loss of personal identity. The Pandit Kavinda believes that he's under a possession by a demon. So malingering has been said to be synonymous with faking, lying, and fraud. The DSM-4 defines malingering as a intentional production of false or grossly exaggerated physical or psychological symptoms motivated by external incentives. Although malingering is not considered a mental disorder, it's recognized by the DSM as something that warrants clinical attention. Many Jataka stories describe malingerers who were interested in secondary gain. In Bandhana Moksha Jataka, a queen with adulterous behavior fakes illness to trick the king. She pretends that she became a victim of an attempted rape. She presents herself with self-inflicted bruises and bogus emotional complaints to prove the rape. So this could be something like rape trauma syndrome. But the truth was revealed and the queen was punished. We find hyperactive sexual desire disorder in Jataka stories. Many centuries before Sigmund Freud, Richard von Krafft-Ebing, Albert Moll, or D.H. Lawrence, the Tantric Buddhist monks describe and discuss the wider aspects of human sexuality. So hypoactive sexual desire disorder is defined as deficiency or absence of sexual fantasies and desires for sexual activity. The disturbance must cause marked distress or interpersonal difficulty. The Jataka storyteller describes the complex behavioral components of a young man named Pinguttara, who exhibits firm features of hypoactive sexual desire disorder. He had no interest in his newly wedded beautiful wife, Udumbara Devi. He finds no erotic satisfaction in her, and the wife becomes a burden to him. He abandoned her and fled due to lack of interest in women. We found sexual addiction as well. Sexual addiction is a form of compulsive sexual behavior in which the individual is unable to control their sexual urges, behaviors, or thoughts. In 1987, the APS Statistical Manual of Mental Disorders, DSM-3R, added for the first time the concept of sexual addiction as a specific descriptor that might be applied under the more general diagnosis of sexual disorders not otherwise specified. Jataka stories describes individuals with extreme desire for carnal pleasure. For example, the Mahakunala Jataka portrays a princess named Krishna who had suggestive features of nymphomania or sexual addiction. Prince Stulakumarika in Chulanarada Jataka has an insatiable desire for sex. She needs multiple partners to satisfy her erotic desires. The Jataka storyteller talked about Bonnier-Klein syndrome, also known as hybristophilia. Please listen to this. Bonnier-Klein syndrome or hybristophilia is a paraphilia of the predatory type of which sexual arousal, facilitation, and attainment or orgasm are responsive to and contingent upon being with a partner known to have committed an outrage, cheating, lying, known infidelities, or crime such as rape or murder. The Buddhist literature reveals a rich girl named Kundalakesi who was sternly attracted to a criminal when she accidentally saw him through her window. The king's men were taking him to the burial grounds to decapitate him. His well-built physique with rough vagabond look vigorously attracted her. She immediately fell in love with the criminal, and she had this urge to be with this criminal. She pleaded her wealthy father to rescue the outlaw from the king's men. The affluent father bribed the king's men and released the criminal. He was secretly brought to Kundalakesi's house and they became husband and wife. The term voyeurism refers to the desire to spy on unsuspecting and non-consenting people during their private activities. Voyeurism is considered a precondition for voyeuristic disorder. Voyeuristic disorder belongs to a group of mental conditions under paraphilic disorders in the APA DSM-5. According to the Bahia Jataka story, a king with voyeuristic tendencies achieves sexual gratification by observing a woman in the act of urinating and defecating. After seeing the woman, the king becomes sexually excited and fantasizes about her. Then he orders his men to bring the woman to the palace. We find zoophilia in Jataka stories. Zoophilia is a paraphilia whereby the perpetrator gets sexual pleasure in having sex with animals. The Jataka storyteller vividly described the zoophilia, bestiality tendency of the Queen Mallika, who had a sexual encounter with an animal. As the king observes from the upper floor, his queen is having a sexual encounter with a dog. He becomes puzzled and thinks that it was an optical illusion. Later, the Queen Mallika tricks the king and convinces him that it was a misapprehension. The Jataka stories describe fetishism in a young man named Kema. Fetishism is a paraphilic sexual disorder characterized by recurrent intense sexually arousing fantasies, sexual urges, or behaviors involving the use of non-living objects. So Kema obtains sexual arousal by stealing sandals that belong to a young and attractive princess. Kema is attracted to the princess, but his fears and inner mental conflicts prevent him meeting with the princess, but he gratifies his erotic desires, keeping her pair of sandals. There are a number of pedophiles in the Jataka stories. So pedophilic disorder is defined as having recurrent, intense, sexually arousing fantasies, sexual urges, or behaviors involving sexual activity with prepubescent child or a children over a period of at least 6 months. Several Jataka stories were based on paraphilic subjects committing sexual offenses against children. In Chulanarada Jataka, a grown woman seduces an underage boy and sexually abuses him. After the abuse, she plans to take him out of his father's care. In Buddhist Jataka, a male child was molested by an adult woman. Kraft Ebing coined the term masochism. Prior to that, Albert von Notzing used the term algolagnia to refer the sexual pleasure derived from pain. Algolagnia included sexual humiliation, subjection, and the desire to be under the power of another. Some of the Jataka stories discuss sexual sadism and masochism. For instance, in Andabhuta Jataka, a young wife derives sadistic satisfaction by hitting her blindfolded old husband and also humiliating him while having sexual intercourse with her young lover. Munchausen syndrome by proxy was first identified in 1977 by Dr. Roy Meadow, a British pediatrician. Munchausen syndrome by proxy was formally acknowledged by the American Psychiatric Association in 1994 when it was entered the DSM 4 under the general title Fictitious Disorders by Proxy. Munchausen syndrome by proxy is a form of abuse in which caregiver deliberately produces illness in a person under his or her care so that the proxy will receive a medical care that gratifies the caregiver. The Jataka stories describe several female characters that secretly harmed children when they were under the perpetrator's care. Kali was such a woman who harmed two infants of her female friend following a deep-rooted revenge. In Shantivadi Jataka depicts a character that bears psychological criteria that are similar to the antisocial personality disorder. So antisocial personality disorder is a pervasive pattern of disregard for and violation of the rights of others that begins in childhood or early adolescence and continues into adulthood. Lack of remorse, poor behavior control, tendency to violate the boundaries and rights of others, and aggressive violent behavior are more common in antisocial personality disorder. The Kshantivadi Jataka story narrates negative characteristics of an aggressive king named Kalabu. He ruthlessly tortures a hermit. So King Kalabu seems to be having antisocial personality disorder. And we find borderline personality disorder in the Jataka stories. The term borderline personality disorder was coined in 1938 by Adolf Stern, a psychoanalyst, who viewed the symptoms of borderline personality disorder as being on the borderline between psychosis and neurosis. A student monk in the Kuti Dushaka Jataka was unstable and intense interpersonal relationships, and he is troubled by impulsivity. He's emotionally unstable and has extreme anger. His marked mood swings interrupt his spiritual practices. He has difficulty in dealing with relationships and social situations. He is handling emotions and thoughts in an inappropriate manner. His emotionally volatile behavior becomes more and more intolerable to others. His feelings of emptiness leads to a deceitful character. Finally, he gets angry with everyone in the monastery and set fire to it. Then he flees. This student monk would fit into borderline personality disorder. Jataka stories discusses a number of psychopaths such as Bodhisattva, Alavaka, and Angulimala. These psychopaths lack moral emotions, and their lack of remorse and lack of empathy were very much evident. However, as the Jataka stories highlight, they had the intellectual and moral capacity to reform and renounce violence. Histrionic personality disorder is defined by the American Psychiatric Association as a personality disorder. People with histrionic personality disorder have a high need for attention, make loud and inappropriate appearances, exaggerate their behaviors and emotions, and crave stimulation. They have strong, unstable emotions with an impressionistic style and can be easily influenced by others. They are egocentric and persistently manipulative. Their self-esteem depends on the approval of others. So Bhikkhu Kokalika's character would fit into histrionic personality disorder. He was egocentric and used to exaggerate and dramatize events. He acted on impulses, and once he verbally abused Buddha's two chief disciples. When Devadatta decided to cause division among the Sangha, he used Bhikkhu Kokalika. Kokalika had an excessive need for approval. He was flattered by Devadatta, who had hidden motives. Soon Kokalika joined with Devadatta and worked against Buddha. But in the latter stage, Kokalika became angry with Devadatta and he brutally assaulted Devadatta. And later on, Devadatta became seriously ill and it caused his death. According to the DSM description, narcissistic personality disorder is a personality disorder. An individual with narcissistic personality disorder has grandiose sense of self-importance. She is preoccupied with fantasies of unlimited success, power, brilliance, beauty, or ideal love, and believes that he or she is special. The Jataka storybook discusses a woman named Magandhya who had malignant narcissistic personality traits. She was beautiful and swollen with pride. She was histrionic and coquettish. Magandhya was glib and superficial. She bore an exploitative and unempathetic character. Jataka storybook talks about hubris syndrome. According to Owen, in 2008, hubris syndrome is associated with power more likely to manifest itself the longer the person exercises power and the greater the power they exercise. The Jataka storybook describes several kings who seem to have been affected by hubris syndrome. The king Vidudaba surely fits into this category. King Vidudaba was an arrogant and aggressive monarch. He was a ruthless, reckless, and impulsive individual with too much self-confidence. His arrogance and aggressive behavior caused an immense bloodshed among the Shakya clan. Jataka storyteller talked about Stockholm syndrome. Stockholm syndrome was initially used to describe the experience of hostage in Stockholm, Sweden, who expressed positive feelings towards their captors. Stockholm syndrome or capture bonding is a pathological phenomenon in which hostages express empathy and sympathy and have positive feelings towards their captors, sometimes to the point of defending and identifying with them. Kanavara Jataka of the Jataka storybook bears a story which is similar to Stockholm syndrome. The storyline about a rich young girl named Sama who was frantically allied with a robber from the village Kasi. Sama saved this notorious bandit from the legal hands and lived with him. The bandit once took her to a park and on the pretense of embracing her, squeezed Sama's neck until she lost her consciousness. Then the robber gathered all her jewelry and escaped, thinking that Sama died on the spot. However, as soon as Sama came back to her senses, she looked for the bandit. She had strong affection and sympathy for the robber who tried to kill her and robbed her precious jewelry. She became so obsessed and started searching for him. Unable to console herself, she wandered from place to place, crying for him, his name. She composed a song describing love and affection towards the outlaw. So erotomania is generally classified as a delusional disorder in contemporary classification systems of DSM-4. The core symptoms of erotomania is the sufferer holds an unshakable belief that another person is secretly in love with them. Asankavati Jataka describes a monk who was in love with a beautiful woman, although the woman was unaware of and was not interested in her secret admirer, the said monk had vivid fantasies about her. He strongly believed that the woman was in love with him and he neglected his spiritual advancement. Later, Buddha summoned the monk and showed him the emptiness of his delusional belief. After realizing his mistake, the monk abandoned his erotic thoughts for her and meditated with a strong determination. Hence, he was able to find a higher spiritual path. A compulsive hoarding is a debilitating illness that is characterized by excessive collection and failure to discard items, irrespective of their uselessness or hazardousness. Sakuna Jataka is a story about female Buddhist monk who had greedy and hoarding tendencies. She was collecting various items and had a difficulty parting with these possessions. Her hoarding caused significant distress in her spiritual life and it prevented her from growth promotion. The Jataka storybook described post-traumatic growth. Post-traumatic growth is the positive psychological change experienced as a result of a struggle with challenging life circumstances that represent significant challenges to the adaptive resources to the individual and an individual's ways of understanding the world and once they are placed in it. Post-traumatic growth is manifested in several clearly defined behaviors and thought patterns, not necessarily present prior to exposure. Post-traumatic growth has been vibrantly described in Jataka storybook, disclosing a number of case studies. These people faced major life traumas and became overwhelmed. However, they found meaning in their suffering and they experienced post-traumatic growth. For example, we can say Patachara and also Kisa Gautami, who lost her infant son and went into a very depressive reaction. But later, they were able to gain post-traumatic growth. The renowned Sri Lankan literary genius Martin Wickramasinghe believed that Fyodor Dostoevsky may have had some influence by Asatramanta Jataka story to write the psycho-philosophical novel Brother Karamazov. There are many similarities between Fyodor Dostoevsky's Brothers Karamazov and Asatramanta Jataka story. Both stories describe the sexual craving and indulgence in old age, violating social and moral norms. Both stories profoundly analyze the inner mental conflicts, revealing the darkest side of human mind. Martin Wickramasinghe saw similarities in French writer Molière's Tartuffe and Somanasa Jataka. In both stories, they narrate a similar kind of person who pretends to be someone else, a sanctimonious scoundrel who professing extreme piety. So there's a much similarity between Somanasa Jataka and Tartuffe. So these both stories describe about a con man. Martin Wickramasinghe sees similarities between Oscar Wilde's Salome and Chaddanta Jataka story, both about the sacrifices. Jataka stories describe how human emotions change due to situational factors. These tales also discuss good and evil in a same person in different circumstances. So in modern day, this idea was eloquently said by the psychologist Albert Bandura. He says our ability to selectively engage and disengage our moral standards helps explain how people can be barbarically cruel in one moment and compassionate the next. Martin Wickramasinghe states that way before Sigmund Freud, the Jataka storyteller analyzed the human mind. Martin Wickramasinghe gives solid examples to qualify his opinion. So he see a lot of psychoanalysis, mental analysis in Jataka storybook. The Jataka stories help to understand the dynamics of the human mind, giving a variety of stories. These stories highlight how human mind perceives ideas, how human mind reacts in extreme situations. It narrates self-centeredness to selflessness, anger to loving kindness, self-indulgence to search for meaning. The Jataka stories emphasize the power of human mind and mind supremacy. So we see Jataka stories really describe most of the DSM based psychological and psychiatric ailments. It's so beautiful with this ancient knowledge. And I think the Western world uh, should study about the Jataka stories, which can be called the ancient DSM. So that ends my presentation. Thank you very much, everybody. So again, I thank Buddhist and Pali University of Sri Lanka, and also to Reverend Yodakangi Arivan Satero for organizing this. Thank you very much.